Hello everyone, my name is Gia and I'm a CA3 at Jefferson. I would like to present a case about a patient who has developed thrombocytopenia and decreased fibrinogens during 4 PHP procedures. My mentor is Dr. Yoon. Before I dive into the presentations, I would like to talk briefly about the procedure itself. PHP, Percutaneous Hepatic Perfusion, aka the Delcat procedure, is an IR procedure that delivers high dose and high concentration of chemotherapy agents to the patient's liver who has history of hepatic metastasis. The procedure utilizes veno-venous bypass when blood flow from the liver was temporarily occluded. At the end of the case, blood from the liver goes through a charcoal filter to remove excessive chemotherapy before return to the patient's systemic circulation. Now let's talk about the case. This is a patient in her 60s who presents to the hospital for 4 separate PHP procedures in the span of 6 months. Her past medical history is significant for uveal melanomas with liver metastasis. Each procedure was performed under general anesthesia with endotracheal intubations. Once the patient is induced, vascular SS includes femoral A line, triple lumen central venous line, as well as large peripheral IVs. Vasopressor agents include norepinephrine infusions and occasional boluses of phenylephrine and epinephrine. Prior to the initiations of veno-venous bypass, 35,000 units of heparin was given to the patient to achieve an ACT of greater than 450 seconds. Once the goal of ACT is achieved, a double balloon catheter was placed in the IVC to isolate the liver's blood flow. Then high-dose chemotherapy Melphalan was delivered to the patient's liver, targeting the tumor cells while minimizing systemic exposures. After treatment, blood from the liver is filtered through a charcoal filter to remove excessive chemotherapy drugs before returning to the systemic circulations. CBC, coagulation panel, and rotem analysis were collected during and after the procedures. Here is the findings of patients' platelet count as well as fibrinogen levels during 4 separate procedures. As you can tell from the left-sided figure, patient has developed significant thrombocytopenia after each procedure, in particularly shortly after the charcoal filter opening. In addition, patient also has decreased fibrinogens at the end of each procedure as well. However, when we run an extem analysis, we find that the patient's maximum clot formation is only about 11% reductions. So the very top figure is the patient's baseline, which shows an MCF of 63. And then 60 minutes after the charcoal filter is when we see an MCF of about 45. However, patient's MCF has quickly recovered to almost baseline when she has arrived in PACU for about 60 minutes. In addition to the extem analysis, we have also collected some FIPTIM analysis to assess the patient's fibrinogens functionality. As you can see from the top figure, patient baseline is normal. However, the second figure shows that about 60 minutes after the filter opening, patient has a 40% reduction in her FIPTIM analysis as well. Similar to the extem analysis, which did not include it in this slideshow, is that patient's FIPTIM has also returned to her baseline when she arrived in the PACU. Overall, our case shows that thrombocytopenia and decreased fibrinogens are common and transient for patients undergoing the Delcat procedures. Despite showing significant abnormalities in our quantitative assessment, which are the platelet count and fibrinogen number, our qualitative assessment from viscoelastic testings are grossly within normal limit or has quickly recovered to baseline, indicating that transfusions with platelet or cryoprecipitates is not necessary in the absence of significant clinical bleeding. In conclusions, viscoelastic testing is a very effective strategy to determine whether the patient will need intervention during and after the PHP procedures. In addition, this practice can limit the amount of unnecessary transfusion and provide an early indication of any potential coagulation abnormality. Here is the poster for my ASA's presentations. Thank you so much for your attention.